So I've been able to do inpatient and outpatient. And honestly, I think I like inpatient better. So inpatient is when we see all the oncology patients that are having a lot of symptoms to chemotherapy, for example, or for patients that are just finding out that they have cancer. Sometimes it can be very sad, but overall, I like how different it is and how many patients you can see. Usually in my group, we cover a couple hospitals. One hospital has about maybe 40, 45 patients every single day, while the other hospital has about 20 patients. So our load is pretty big, but we share in between multiple nurse practitioners and physicians. Then outpatient in the clinic, I love it a lot too. It's a little bit more steady. Usually for nurse practitioners for this first year, I've seen between like 14 patients a day to 21 patients a day. I like how it is steady, and I like it's mostly trying to keep the patients outside of the hospital, managing side effects for chemotherapy, sometimes discussing how they're responding to their chemotherapy treatment. So I like that in my practice we can do both because it's a lot of experience, especially for my first year. I've learned so much. I think I prefer inpatient a little bit more. Maybe it's because of my training. I was trained as an acute care nurse practitioner, so most of my training, or actually all of my training, was in the hospital setting. So acute situations, the most sick people that we're trying to manage in the hospital. However, I do like outpatient, and I like all the team, the MAs, the nurses. It seems more like you're working as a team outpatient versus inpatient. It seems a little bit more isolated sometimes. But the good thing about inpatient is that you can manage your time. So I can decide which patient to see first, when I'm gonna have my coffee, when I'm gonna have lunch, versus outpatient. I have, because the patients are coming at specific times, I have not a lot of flexibility on how I manage my time. But I love both. Prefer inpatient, but I love that our practice allows us to do both, and I think all oncology practice should do that to enhance experience, and also because it gives you a perspective of what happens when symptoms are not managed and patients are in the hospital, or how do we find the cancers in some of these people. What are the first symptoms, like abdominal pain, headaches, etc. So really awesome experience to be exposed to both. Okay, bye bye.